Hello everyone, welcome to GrowMed. In this video, we will discuss about the previous year questions which are asked in the FMGE. So the past 5 years questions and the topics we will be discussing in this video so that those who all are preparing for the December exam, it will be easy for you guys that in one single video all the important PYQs will be covered so that you do not need to go to any other source for this. Okay, so let's get started and we will discuss about the recent exam. The questions asked in the recent exam, that is July 2024. Okay, and then we will discuss about the other exams. So in this July exam, the questions asked were like approximately 15 questions, and these were not the 15 purely from the anatomy because these had come in combined with the ENT. Some had come with the ENT, then some from the surgery. Okay, so ये सारे ना इंटीग्रेटेड वाले क्वेश्चन है, तो वी जस्ट कैन नॉट से कि ये इसी में से आया था. ओके, जस्ट द थिंग दैट दीज क्वेश्चंस हैड कम एंड यू नीड टू नो द आंसर. So the question asked on the anterior fontanelle closes at 12 to 24 months. Okay, so this was the question asked in the recent July exam, and this is the answer. So we will be discussing about the topics because topics are more important rather than the previous year questions. क्योंकि questions repeat होना मतलब it's rare thing, मतलब पूरा का पूरा question repeat नहीं हो सकता. So the topics which are there, no, those will be repeated, and the questions from the topics can be repeated. Like they can change the pattern of the question. Sometimes they can ask the clinical case, or sometimes they can ask the one liner regarding that topic, or sometimes the investigation of choice management essay. So you need to know all the things regarding that one topic, not only the PYQ. So the anterior fontanelle, it closes at 12 to 14 months. So this time they had asked about the anterior fontanelle. So what you need to do is, in the upcoming exam, this is an important topic and you need to know that posterior when it closes, and then the other fontanelles also. Okay, then esophageal constriction. So question was asked on this esophageal constrictions, and this time the question had asked on this 25 centimeter arc. I don't know exactly how was the question, what was the pattern of the question, whether it was a clinical case or like simple thing was asked. I don't know that exact pattern of the question. So but you need to just remember esophageal constrictions, and also I have discussed about this in the 100 important PDF. Okay, then epithelium of the trachea. So epithelium also is an important topic, and you can expect a question from this epithelium in every exam. So this time there was this question on the trachea, and in the past years there were question like on the fallopian tube, then in the other various locations. Okay, so this time it was on the trachea, and it is the ciliated pseudostratified columnar, which is the answer. Then from the joints also you can expect a question, so which are I am marking the star mark. No, these are the repeat topic, and chances are there that these can be repeated even in the NEET PG also. Then joints, this time the question was on the synchondrosis. So they had asked between the epiphysis and the diaphysis, which is the synchondrosis. Then cavernous sinus contents and injury. So there was a clinical case described that a patient comes with so and so clinical features, and you which structure or which vessel or which nerve can be damaged, and something question was asked like this. So you need to know the contents of the cavernous sinus. There are various nerves present, right? Cranial nerve 3, 4 and 6 passes through it. So when these things are damaged, what features can be seen? You need to read this. Then brain also, this is also a repeat topic, and in every paper this brain image is asked. So they'll give a cross section of the brain like this, and they'll mark any of the thing, and they'll ask what is that feature. Okay, so this is the putamen, then this is the, sorry, this is the quadrate, this is the putamen, and here comes the internal capsule. Then here comes the thalamus. So in a video I've discussed about this complete thing, that all the markings and what all questions were asked. It is with the name of the images, anatomy images, so do watch that video also. Okay, so this one also you can expect in the future. So splenorenal ligament image based question. So this is the image, and the question was asked that this is the splenorenal ligament, no, not this one, sorry, this is the splenorenal ligament. So this is the spleen and this is the renal system now. The splenorenal ligament, what structures pass through this one, the question was asked, or the image based question was asked, I think. What is this marking given? Okay, so don't know the exact, but this is also a repeat topic. Then posterior tibial artery is palpable, so image based question. This image can be given and they can ask which artery is being palpated, and that one is the posterior tibial artery. So this is also a repeat topic. Then pharyngeal arch derivatives are must know topic, and you can seriously expect one question from this in the even in the NEET PG as well as the FMG December. Okay, so FMG December के लिए which all I'm saying na कि yeah, these are short like the brain. So note down these things and मेक अ लिस्ट ऑफ दिस थिंग्स, और अलग से सेपरेट से नोट्स बनाना इनके, एंड नोट डाउन दिस थिंग्स। सारी चीज़ें जो जो आपको पढ़नी है इसमें से mark those things and make a book like a 20th notebook. Okay, so it will be like all the important topics in a single PDF or a notebook. You will be doing it from now onwards when you're studying, so that in the last minute you'll be not scratching your head कि ये कहाँ से पढ़ना है, ये कहाँ से पढ़ना है, ये कहाँ से करो. Okay, so organize the things, manage it from now only. Start doing the things easier from now only. Okay, so pharyngeal arch derivatives, note it down and write all the important points related to this. So there was a question asked on this sixth pharyngeal arch artery. So which artery is derived from the left, I think, don't remember exactly, but this question was asked. Okay, so you need to remember all the things, the muscles which are derived, then the cartilages which are derived, then along with that the bones which are derived, all those things, and also their nerve supply. Then moving on to liver segment. So the image based question was asked, marking an liver segment, and I think it was the sixth segment which was marked. Okay, then not able to recall exactly, but images, yeah, sorry, liver segment pe. Then pterygopalatine ganglion pe image based question. Okay, so they had marked this pterygopalatine ganglion in the image and they had asked which ganglion it is. Then accessory nerve injury, the clinical case was described, and in the clinical case there was a hint word given: patient is finding difficulty in shrugging the shoulder. So whenever this a term is described in the clinical case, mark the answer as the accessory nerve injury. Then nerve injury is also a repeat topic, and this time there was a nerve injury on this accessory nerve and the cranial nerve 7. So this is also a repeat topic, and a cranial nerve 7 injury will be like repeat topic, and you can expect a question. Okay, so all the things from the cranial nerve 7 you need to read from today onwards, today itself. Okay, मार्क दिस थिंग्स, सारी चीज़ें निकाल लेना जहाँ जहाँ से भी मिले आपको क्रेनियल नर्व 7 से, PYQs देख लेना, फिर जो वीडियोस है, जो कोचिंग की वीडियोस है, सारी चीज़ें छान मार लेना, क्रेनियल नर्व 7 इंजरी की जो जो पॉइंट्स है सब एक जगह पे लिख लेना. ओके, then so PDA surgery, patent ductus arteriosus surgery was being done, and nerve was injured. So which nerve can be injured? It is the left recurrent laryngeal nerve which is damaged in case of the PDA. Okay, then this was a slight like new question, this was not a repeat question, but still this is a important topic. Then the lymphoid, primary lymphoid organ which is the thymus. Okay, this is not a repeat topic, and this was a like quite easier question, that primary lymphoid organ. Okay, so these were the questions asked in this July 2024. Then moving on to the December 2023, the question was asked on the anatomical snuff box, again a repeat topic. So questions have been repeatedly asked on the boundaries as well as the content. तो content तो radial artery है, हमको पता है. EPL was the question which was asked, and this is the image of this anatomical snuff box. So they can also give a marking like this, they'll mark which ligament it is, what is the mark structure ऐसे. ठीक है, then cross section of the heart was given, and they had asked which artery it is, artery ne atrium. So I think marking of the left atrium was given, and they had asked what it is. Okay, so simple. See, basic questions have been also asked in the FMG, so you need to stick to the basics से start करना. And if you also leave the like high yield नहीं, मतलब कि जो बहुत ही हाई लेवल की चीज़ें हैं ना, इफ़ यू लीव दैट ऑल्सो इट्स ओके, बट यू नीड टू स्टिक टू द बेसिक्स एंड कंप्लीट द बेसिक्स, एंड वॉट आर बीइंग आस्क्ड इन द एग्जाम्स, इसको तो आपको करके ही जाना है. लाइक दिस वर्टिब्रल लेवल एंड द ट्रांसपाइलोरी प्लेन. सो वर्टिब्रल लेवल इज ऑल्सो अ रिपीट टॉपिक, and frequently questions have been asked on this vertebral level, and there are different vertebral level. Okay, so the 100 important PDF which I've made, I've written all those things in this vertebral level mentioned in this, and also the video with the 10 most important topics which you must do from the anatomy. So do watch that video and note down all the important points and start your preparation from today itself. Okay, Then anencephaly neural tube defect, this is also a repeat topic, and you can expect a question on this neural tube defect. So one question expected कि December exam में भी आएगा ही आएगा, and this time in the July exam also a question was asked on this, and this time the question was asked on the drug. So for prevention of the neural tube defect we will be giving the folic acid, vitamin B9. Okay, so this question was asked in this July recent exam. Then flexor carpi radialis image based question was asked, marking this flexor carpi radialis. Then lesser trochanter of the femur, and in that there will be the psoas major insertion. Omphalocele and the gastroschisis, these are also a repeat topic, and you can see the image here. Omphalocele here, which was asked in the exam, and similar image of the gastroschisis where there will be, you can see herniation of the intestinal content. This is also a repeat topic. Then the Hazelback triangle, so boundaries were asked, and you need to look at all the things from this, the content as well as the boundaries, and along with that the other triangles like the femoral triangle which is there, then the axilla, what all contents are there, the boundaries of the axilla, then the cubital fossa, all these things. So you can already find these things in the video with the name of the 10 most important topics from the anatomy. Then joints, so as expected, the question on the joints between the first metacarpal and the trapezium, image based question was asked, I think, marking these two, and they had asked what joint is seen in between of them. Then common carotid artery is palpated at cartilage at C6, which is at the level of the cricoid cartilage. Again you can see here the vertebral levels. Vertebral levels का एक question दो आया था vertebral levels पे. Then the conjoint tendon they had asked. Then also on the diaphragm, the embryological derivatives of the diaphragm. Okay, so this is the image of this flexor carpi tendon. This is the image which they had marked and asked the type of joint present here. Okay, so these were the questions asked in the December 2023. Then in the June 2023, the questions asked were the wrist drop, which is the radial nerve injury. So nerve injury, see one question from the nerve injury, and you can see that anatomical stuff box also repeat topic, and this time the question was like scaphoid will be fracturing if there is injury to the anatomical snuff box. And this wrist drop image based question, this is the image, and radial nerve is injured. So all the nerve injuries you need to know the radial nerve तो हमने अभी पढ़ा ही. Then radial के साथ में you need to know the ulnar nerve injury, what all it causes. Then median nerve injury, what all it causes. Then common peroneal nerve which will be causing the foot drop, all these things. Then bulbar urethra injury, this is also a repeat topic. So they'll ask which part of the bulb urethra is injured, whether it is membranous part or whether it is bulbar part, describing a case that they'll describe there is bleeding seen at the tip of the urethra, which part is damaged ऐसे करके. Then this hemorrhage is also a repeat topic, and this time I think in the July exam there were 2 or 3 questions on this hemorrhage. So one was on subarachnoid hemorrhage, then other one was on the um, subdural hemorrhage. Okay, so EDH middle meningeal artery, which is the pterion, at the marking which is called as the pterion, there is middle meningeal artery present. Then pleural tap is done at the upper border of the rib, because at the lower border there will be neural vascular structures passing, and to avoid injury to them we will be doing it in the upper border. So vertebral level, again a repeat topic. This time it was the iliac crest. So iliac crest was marked, and they had asked which vertebral level it is. Then spinal accessory nerve injury, so this is the image which was given, and it will be causing this long thoracic nerve, long thoracic winging of scapula. So this one is associated with this spinal accessory nerve injury. Housemaid's knee prepatellar brusa, this is called as prepatellar brusa. Then neural tube defect, again a repeat topic. So question can be even uh, on the anencephaly or the spina bifida occulta, and this time the question was asked on the spina bifida occulta in the July exam. July exam there was a question on the spina bifida occulta. Then biceps muscle rupture, image based question was asked. Facial nerve injury, again we have discussed that it is an important topic, repeat topic. Then phrenic nerve was given, and they had asked the marking, image based question. Caudal dysgenesis occurs in the gastrulation and the superior gluteal nerve injury. So what signs can be seen in case of the superior gluteal nerve injury? So these were the topics which were asked in the June 2023, and as well as the questions. So you need to read all these things thoroughly. Then about the December 2023, so this is also again a repeat topic. See, transtubercular plane present at the alpha image based question was asked. Brain brain cross section was given an internal capsule. We had already discussed here about the image of the brain. So this was asked and again repeat topic. Then cleft lip image based question was asked. Cleft lip image is not there here, but do watch these images. All these images have been discussed in the video with the name of images from the anatomy. So all the important images have been covered there, so do watch that video. The link will be given in the description box. Then splenic vessels will be passing through which ligament? So it is the linear-renal ligament, and this was the question asked, and this question was repeat asked in the July, as we have discussed here. तो हमने यहाँ डिस्कस किया ना linear-renal ligament. Then humerus fracture will be causing ulnar nerve injury. Again, nerve injury का we had discussed, important है. Sternal angle is present at the level of T4. Then esophageal constrictions repeated even in the July also. Then diaphragm opening question was asked on the diaphragm opening, and you need to know all the three opening: aortic opening, then esophageal opening, and inferior vena cava opening, and along with that the vertebral levels where they open. Then paracentral lobule damage, and the question clinical case was described: weakness of the lower limbs will be happening in case of the paracentral lobule. Then Trendelenburg sign, so we know that it is due to the damage to the gluteal muscles which will be causing this Trendelenburg sign. Then if there is elbow fracture, there will be brachial artery injury happening, and this was the question asked. A simple one liner was asked that a patient presents with the elbow fracture, so which of the following artery is most likely to be injured in the patient? So it was the brachial artery. Then brachial cyst, it occurs due to the second persistent. So this is also a topic from this pharyngeal arches. So second persistent pharyngeal, I think cleft जो होगा persistent होगा, उसके वजह से this will be seen. Then lacrimal sac which is present at the medial aspect of the orbit. Then x-ray was given of the ribs, so this one will be coming in integration with the radio also. Okay. Then left atrium location was asked, image based question. So heart cross section they had given, and they were marking which what is this structure. So it was the left atrium which was given in the question. Then epithelium, we had discussed that this is a repeat topic and the question can come on this. And the Bell's palsy, which is a cranial nerve 7 palsy. Okay, so these were the questions asked. And see, if you analyze the things, no, most of them are the repeat topics. So for the anatomy, especially for the anatomy, you need to scratch more much head, like reading all the things from the anatomy, analyze the things, divide it, and make the things easier, and first finish all these important things which are asked. Then June 2022, posterior tibial arteries palpable. See, again an image, repeat topic. Then brain image cross section, and this time they had asked for the pons. Anatomical snuff box, again the repeat topic, and we have already discussed that the questions are asked on the boundaries as well as the content and the scaphoid fracture. Then supraspinatus muscle will be doing the abduction. Middle radioulnar joint is a type of syndesmosis. Joint पे भी again a question had come. Then supination and pronation is done by the pivot joint which is present at the wrist. Abdominal planes and vertebral levels. So the question, image based question will be given like this. So this plane, then this plane, they will be marking these planes, and they will ask which plane it is or what is the vertebral level. So this is the transpyloric plane, then this is the umbilicus, and they can mark this, and they can ask what is the dermatome of this or what is the vertebral level of this. So vertebral level will be the between the L4 and L3, and this one the iliac crest, so it will be the L4. Okay, so questions can be asked like this. So एक इमेज में ही कितने सारे पैटर्न्स बन गए क्वेश्चन के. Then hypoglossal nerve injury, so injury of the tongue, and tongue will be deviated to the same side of the injury. So this will be described in the clinical case. Then pharyngeal arches, again a repeat topic. So pharyngeal arches is like you need to read all the things from the pharyngeal arches. Then clavicle fracture. So I think the question had asked on the location of this clavicle fracture, and we all know that which is the most common site of this clavicle fracture. Then the vertebral level C4 C3 image based question. So I think this comes in integration with the radiology. They had given an X-ray, and in that there was a marking between the C3 and the C4 vertebral level, and they had asked what is this vertebral level. If you see the X-ray, you will be easily able to find out कि वो कौन से level का vertebra है. Then medulla image based question. So medulla part of the brain, so they had marked the medulla and they had asked what is this. Then thorax also image based question was asked, and in the brain again straight sinus. So question was asked on the straight sinus. This is the image of the brain. It will be given something like this, and they'll mark this thing and they'll ask what is this structure. So it will be the straight sinus. Then foreign body in the esophagus or the trachea. This is also a repeat topic, and I've already discussed about this one in this 100 most important PDF. Uh, so it can be image based question asked on this, and this comes in integration with the ENT also. So you need to see the foreign body which it is present either in the esophagus or the trachea. Okay, so that's all in this video, guys. We have discussed about the important topics which were asked in the FMG. Hope this video will make your preparation easier, and for more detailed video watch the other videos. And for the anatomy, there's a playlist with the name of the anatomy and all the important videos you can find there. Okay, so thank you so much for watching this video. I am Dr. Padmini, your mentor for the FMG. Once again, thank you so much, guys. Bye bye.